For my last project, I will be explaining how high school athletes use nicotine and the performance effects it has. Nicotine is a chemical that contains nitrogen and is made with several plants, including the tobacco plant. Although it doesn't cause cancer, nicotine is very addictive and can affect the body in many ways. Between 1/3 and 1/2 of professional athletes use nicotine, and sports people claim that it helps prevent dry mouth, control body weight, and improve concentration and attention. Studies show that high school athletes use smokeless tobacco at a higher rate than non-athletes, and data also shows a relationship between the number of sports a person plays and his or her tobacco use. Athletes that play more sports use less smokeless tobacco. Baseball is the sport most known for using tobacco, but it also has been associated with ice hockey, American football, gymnastics, rugby, and skiing. Smoking kills about 6 million people worldwide every year. Smoking also reduces aerobic and muscular performance. 10 studies were done investigating the effects of nicotine and performance. 2 of 5 studies that tested nicotine in patches and gum found that it improved exercise endurance and muscular strength, while the other 5 reported negative side effects like coughing, sore throat, nausea, and dizziness, but none reduced exercise performance. There's a lot people don't know about nicotine. When taken at a high dose, nicotine can act like a depressant, meaning it'll lower the level of arousal when taken, making a person feel relaxed. When taken at a low dose, nicotine can act like a stimulant, which means that it can cause increased activity in the body, making a person feel a rush or a kick. This is because nicotine stimulates the adrenal glands, causing the release of adrenaline and dopamine in the pleasure and motivation areas of the brain that give similar effects that occur when people take heroin or cocaine. The American Heart Association says that nicotine consumed from smoking tobacco is one of the hardest substances to quit, and to be at least as hard as quitting heroin. It is also said that one Juul pod has roughly the same amount of nicotine as an entire pack of cigarettes, and adolescents can get addicted easier than adults since their brains are still developing. Scientists are still working to understand more fully the health effects and harmful doses of e-cigarette contents when they are heated and turned into an aerosol for both active users and those who are exposed to it secondhand. One study even found that a 30-minute vaping session had the same adverse effect on the aorta as smoking for 5 minutes. The use of nicotine and tobacco can also lead to hypertension, diabetes, obesity, neurobehavioral defects, infertility, respiratory failure, and an increased risk of developing cardiovascular and metabolic diseases. Nicotine addiction can look different from person to person, but some signs of nicotine addiction include cravings or the feeling like you really need to smoke, going out of your way to use tobacco, feeling anxious or irritable when you can't use tobacco, and continuing to use it because you find it hard to stop. When someone is addicted to nicotine, they may experience symptoms of nicotine withdrawal after they stop using tobacco. These include an increased appetite, nicotine cravings, a cough that could last a few weeks, mild headaches or dizziness, fatigue, constipation, anxiety that can last a few weeks, depression, irritability, and a hard time concentrating. Finally, the treatment of nicotine dependency is known as smoking cessation therapy, and it aims to reduce the urges to consume nicotine as well as the associated health problems. Some drug treatment options include NRT, which is available in skin patches, nasal sprays, inhalers, and gums. They reduce the severity of urges and cravings. There's also bupropion, which is used as an antidepressant but is found to reduce nicotine cravings like the NRT. Another option is varenicline, which is sold as Chantix. This medication triggers a certain receptor in the brain that usually responds to nicotine and blocks it, reducing the urge to smoke and decreases the risk of a relapse. Finally, there's also the option of counseling and psychological support if you don't want any drug treatment. In conclusion, the use of nicotine in sports does not show any good or valid evidence in improving performance and will only give you problems in the long run, so it's best to just stay away from it. Thank you for your time, and I hope you enjoyed.